To be or not to be in pain? That is the question.
Hello, my name is Susan Dickey, and I'm the Director of Nursing Excellence and Innovation here at Christ Hospital. I'm privileged to be included in this videotape. I want to spend just a few minutes talking about our hospital's philosophy and support of the provision of quality care. Quality is inherent in the culture here at Christ Hospital. It's not just a tagline. It's described in our core values and our mission statement. One of our core values is excellence. Our mission statement reads that our team is dedicated to building lasting relationships with patients and their families. As compassionate professionals, we care for patients using evidence-based practices, research, and education. This sustains our commitment to providing excellent patient and family-centered care. We consistently provide our staff with the resources that they need to evaluate and improve processes and clinical outcomes. One example of this is the resources that we have provided with our staff so that they can be involved in this very important NDNQI research study. This study is on pain assessment and management, and next you'll hear from Linda Boss, who will talk to you about research here at Christ Hospital.
Hello, I'm Dr. Linda Boss, and I'm the Director of Nursing Research here at the Christ Hospital. Nurses have long been involved with research around patient care and pain management. We have many ways that we've developed a body of knowledge to help us with pharmacologic and non-pharmacologic management of patients' care. Many patients come to us with either acute or chronic pain that's associated with the specialized care we provide on our different units. But they also may have a secondary pain from other sources that we need to be able to recognize and manage too. A multitude of holistic practices can be entailed in our plans of care. We can provide imagery as an adjuvant to our pain management. We can use relaxation techniques, aromatherapy, acupuncture, massage. A number of different things can help us provide the best care to our patients and improve their overall outcomes so that we can lead to better outcomes such as improved recovery, faster time to discharge. We can help people assume their self-care management sooner and improve quality of life.
Hello. My name is Gigi Robison, and I am the Oncology Clinical Nurse Specialist and the team lead for the NDNQI pain study. NDNQI stands for the National Database of Nursing Quality Indicators. And NDNQI is collaborating with over 200 hospitals and 1,000 units to conduct a national pain study. This study, which is entitled Dissemination and Implementation of Evidence-Based Methods to Measure and Improve Pain Outcomes, will evaluate pain management outcomes. The goal of this project is to measure and improve pain care processes and outcomes. It will be the first time that NDNQI gathers data directly from patients about their pain experience and nursing care. All inpatient units at the Christ Hospital have been chosen to participate in this NDNQI pain study. 7 South and 3 West have been chosen to be in phase 2 of this study, which includes access to multiple pain management resources and tools. Next, Sarah Frazee will describe an innovative strategy created on 7 South.
First scenario, Nurse Know-It-All. In this first scenario, Mrs. Gilbert, who states that she prefers to be addressed as Kate, was admitted to 7 South with congestive heart failure this morning. This evening, she begins to complain of chronic back pain. She has been taking Vicodin off and on for several years for this condition. Her nurse this evening is Nurse Know-It-All.
Hello, Miss Gilbert. How are you today?
Well, I'm okay, but I'm having a little bit of back pain this morning.
You're having some pain, huh?
Yes.
Well, when was your last bowel movement?
My last bowel movement?
Yeah.
Why does that matter? My back hurts.
Well, that could make your back hurt, you know.
I know the difference between back pain and constipation. This is definitely back pain.
Well, you know what? I'm looking here in your records and I don't see anything about you having pain. It doesn't look like your doctor's ordered anything either.
Really?
You must not thought it was too bad.
He prescribed Vicodin for me to take it home when it got bad. That's
that
very
right?
strange. Could you talk to him?
Well, you know what? I'm really busy right now. So
Oh.
I tell you what I'll do. As soon as I make rounds, I'll give him a call. How does that sound?
Well,
See
I'm
ya.
kind of having some
Bye.
pain right now, nurse. Wow, that nurse was awful. She didn't care about my pain at all. This hospital is horrible. I really want to go someplace else. I don't like it here at all.
I am just so sick of all this pain.
What just happened here? The skit began with the patient being assessed by Nurse Know-It-All. When the patient complained of pain, many negative things happened. No pain assessment was completed. The body language that was conveyed showed slight annoyance. Interruption of the patient's description of pain was done, and false assumption that pain was related to constipation, not believing the patient's statement of pain. Looking at the medication administration record, or the MAR, and stating your physician did not order anything for pain was very rude. Turning away from the patient and focusing on the computer, and no sympathy or empathy was shown to someone in pain. Nurse Know-It-All did not offer to call the doctor to request pain medication, but instead told her patient that she would check back later, and if she was still having pain, then she would then call the doctor. This did not validate information that her patient gave her and minimized her concern. The nurse did not even offer to help reposition her or provide another non-pharmacologic intervention. There were many ineffective nursing behaviors and actions, some unintentional, such as inappropriate body language, and others that were intentional, like not calling the physician and minimizing the patient's pain and concern. After Nurse Know-It-All left the room, the patient said, "This is a horrible hospital and I don't like it here. I hurt and I want to go home." That means poor patient satisfaction. That is not what our goal is. Here's what our nurses who watched the skit said. "I hated when she turned her back when that poor patient was talking. I've turned my back before, but will be more careful about it in the future. Why did she stand that way? It looked like she was saying, 'You are wasting my time.' Nonverbals were bad. That nurse has a bad attitude. She must not work here." What was she confusing constipation with back pain for? It made her look incompetent. I think that she wanted to confuse the patient so she would not have to call the doctor. I will never be that nurse. What's the big deal about getting pain medication ordered? The nurse should just go ahead and do it. That patient will give us a bad review when asked, all because of one nurse. It's funny when you look at something like that. It looks like the nurse does not care, but she probably does. She just does not know how to show it. A second scenario, Nurse Fix-It-All. Now we will replay the first scenario. In this scenario, Mrs. Gilbert continues to experience chronic back pain on this evening that she has been admitted to 7 South with congestive heart failure. The difference is that her nurse tonight is Nurse Fix-It-All. Watch closely and see if you can determine which changes in the nurse's approach will make a difference.
Hi, Kate. How are you this evening?
Well, I'm all right. I'm having a bit of back pain, though.
Do you normally have back pain?
I do. I've had it for about a year.
Okay. And what do you do at home for it?
Well, I usually, try to move around a little bit or use an ice pack, which usually works. But if that doesn't work, then I try some Vicodin. My doctor prescribed it for me.
Oh, okay. So how much Vicodin do you usually take at home?
Oh, 1 or 2 just when the pain gets really bad.
Okay. And how would you describe your pain? Is it like aching? Is it dull? Is it sharp?
It's just a dull ache,
Okay.
just kind of always there.
And on a scale of 1 to 10, 0 being no pain at all, and 10 being the worst pain you've ever had in your life, what would you say your pain is?
Well, I'm just not sure what number my pain is.
Okay, why don't we use this little pain assessment guide? The smiley face is no pain at all, and that would be a 0. And the the person crying would be the worst pain that you've ever had. That would be like a 9 or a 10. What do you think your pain is?
Oh, I would say maybe a 5 or a 6.
Okay. So what is your real pain target? What would be acceptable for you to have your pain?
I think if it was a 3, I'd be able to do what I normally do.
Okay. Okay. Well, I'll tell you, let me call the doctor, and in the meantime, we will get you some ice, get you repositioned, and see if that helps your back a little bit
Okay.
while we're waiting for him to give me a call back.
That would be wonderful. Thank you.
Okay.
What just happened here? The nurse established a positive relationship by introducing herself, making eye contact, and using the patient's preferred name. The nurse asked the appropriate pain assessment questions so that patient could fully describe her pain. Nurse Fix-It-All faced the patient and not the computer and made eye contact. The nurse checked the MAR, and upon finding that pain medication had not been ordered, she discussed with the patient what typically helps to relieve her pain at home. She then explained the plan, which was that she was going to page the doctor right then and obtain the patient's agreement with this plan. She offered to help reposition this patient, which the patient had stated helped her arthritis at home. As Nurse Fix-It-All left the room, the patient was heard to say, "I like it here. They really care about me." When asked which patient probably had the most pain control, best outcome, and highest satisfaction level, all of the nurses were able to identify the correct patient. We discussed questions number 5, 6, and 7, along with interventions. To wrap the session up, we asked, which nurse do you choose to be? Here's what our nurses who watched the skit said. That's more like it. That was a good nurse. I would have done that for that patient. It is not so hard to make a call to get pain medication. I like it that she and the patient made a plan. That's what I do. That patient and nurse looked happy. If your patient is happy with your care, your day goes better, and so does your patient's day. I should ask more about other interventions. I just forget about that sometimes. In this scene, Nurse Know-It-All sees Dr. Menon in the hallway and discusses her patient's complaints about pain.
Hey, Dr. Menon, you got a minute?
Sure. What's up?
Hey, that lady in 4, she's complaining of pain. She can't really be in all that much pain. I mean, she's here for heart failure, but she's complaining.
Well, that makes sense. What does she take at home?
I think she takes Vicodin. I don't really know, but how about giving her something strong and knocking her out? You know, I don't want to deal with this.
You know what? I don't have time. Just give her 1 tablet now, Vicodin, and tell her I'll be in later.
All right, if that's what you really want, I'll do that when I get time.
Okay.
What just happened here? Nurse Know-It-All did not believe that her patient was having pain. She conveyed this feeling to the physician. Her body language conveyed annoyance. The physician had the same attitude. Pain management was not a priority for him. As a result, the patient's pain was not relieved. She also had decreased satisfaction with the nurse, the physician, and the hospital. In this scene, Nurse Fix-It-All sees Dr. Menon in the hallway and discusses her patient's complaints about pain.
Hey, Dr. Menon, do you have just a minute?
Sure. What's up?
The Kate Gilbert in 7004, she's been complaining of some back pain. She was admitted this morning with heart failure, but she has chronic back pain. She said she usually takes 2 Vicodin at home. She takes some PRN, but she has used some ice and stuff in the past. We tried all that this morning, but she's still complaining of a pain. She said her pain is like a 6, and her pain goal is like a 3.
Well, we definitely don't want her to have pain. Did she say what's causing the pain? Has she been worked up before?
Yeah, she has chronic arthritis. She had an MRI about a month ago, which showed the arthritis. And then she usually takes the 2 Vicodin at home.
Okay, I'll go talk to her now, and then we'll come up with a plan and get rid of her pain.
Okay.
I'll call you later.
All right, thank you very much.
Thank you.
What just happened here? Nurse Fix-It-All believed that her patient was having pain. She conveyed this belief and her observations to the physician. Relaying a complete and accurate pain assessment enabled the